Your endocrinologist never told you about this one kitchen spice. Those sudden blood sugar spikes after meals. They never checked whether you're using the correct type. One specific spice, the right variety, has been shown to reduce post-meal spikes within a single week. Meanwhile, they prescribe medications costing hundreds of dollars a month. Medications notorious for causing gas, cramping, and severe diarrhea, when this spice costs pennies and often works just as well. A clinical study showed it reduced post-meal blood sugar spikes by 29%. I'm Richard Frank. Give me few minutes. I'll show you exactly which spice it is, which type is safe, the precise timing that makes it effective, and why the common version most people use may actually be harming your liver. The spice is cinnamon, but stop for a moment and check your pantry. If your bottle simply says cinnamon and you paid $2 or $3 for it, there's an overwhelming chance you're using cassia cinnamon. Cassia is not therapeutic. It's a harsh bark that contains high levels of coumarin, a blood-thinning compound that becomes toxic in regular doses. In excess, coumarin attacks the liver. The generic cinnamon sold in most American grocery stores is loaded with it. So while you think you're helping your blood sugar, you may quietly be damaging your liver at the same time. What you actually need is Ceylon cinnamon, sometimes called true cinnamon. But knowing the correct type is only half the story. Most people also use the wrong dose. Take too little and nothing happens. Take too much and you risk low blood sugar episodes. In a moment, I'll give you the exact amount and the narrow 1-hour window that makes this work. And what I'm about to show you may make you question why your endocrinologist jumps straight to expensive prescriptions, when a simple kitchen spice can stabilize blood sugar more gently and more effectively. Last fall, a man named Marvin walked into my office looking worn down and defeated. He was 68 years old, and his blood sugar wasn't just high, it was wildly unstable. That instability was destroying his quality of life. After nearly every meal, his glucose would spike above 220 milligrams per deciliter. Anything above 180 after eating damages blood vessels, nerves, kidneys. It's dangerous. But the spike wasn't even the worst part. 2 hours later, his blood sugar would crash, sometimes down to 70 or lower. He'd become shaky, sweaty, dizzy. His heart would race. His thoughts would feel foggy and scattered. This is called reactive hypoglycemia, when insulin overreacts to a spike and drives glucose dangerously low. Marvin was trapped on this roller coaster every day. Spike after breakfast, crash mid-morning, spike after lunch, crash mid-afternoon, spike after dinner, crash before bed. He was exhausted, anxious, and barely functioning. His endocrinologist reviewed his continuous glucose monitor, the full-day graphs showing every spike and crash, and prescribed a Carbose. A Carbose slows carbohydrate digestion by blocking an enzyme in the small intestine that breaks complex carbs into sugar. In theory, sugar enters the bloodstream more slowly, reducing spikes. In reality, those undigested carbohydrates don't disappear. They pass into the colon, where gut bacteria ferment them, producing gas, bloating, cramping, and relentless diarrhea. Marvin was told the side effects would fade as his body adjusted. The prescription was 50 milligrams, 3 times daily with meals. The cost? Nearly $300 per month. He took his first dose with lunch. Within 2 hours, his stomach was cramping. His abdomen was painfully bloated. He ran to the bathroom 3 times that afternoon. The diarrhea was humiliating. He called his endocrinologist and said, "I can't live like this." She advised cutting the dose in half and slowly increasing it over several weeks. "The side effects are temporary," she said. They weren't. Even at the lower dose, the gas, bloating, and diarrhea continued. After 1 week, Marvin stopped the medication. He decided he'd rather endure blood sugar spikes than live chained to a bathroom. That's when he came to see me, desperate, exhausted, and searching for anything that could stabilize his blood sugar without destroying his digestive system. I reviewed Marvin's continuous glucose monitor data myself. The pattern was unmistakable. His fasting blood sugar hovered around 120. After breakfast, usually oatmeal with a banana, his glucose surged to 230. 2 hours later, it crashed to 65. After lunch, a sandwich and chips, it spiked to 240, then fell again to around 70. His body was flooding his bloodstream with insulin to fight those spikes, but the insulin response was excessive, driving his blood sugar dangerously low. His pancreas was exhausted from this constant overcorrection. I asked Marvin one simple question his endocrinologist never asked. "Do you use cinnamon?" He looked at me, genuinely confused. "Cinnamon. Like for flavor?" "Yes, cinnamon. But not the kind most people buy. Specifically, Ceylon cinnamon, true cinnamon, not the cassia cinnamon sold in nearly every grocery store. Ceylon cinnamon contains natural compounds called polyphenols that improve insulin sensitivity. It helps your cells respond to insulin more efficiently. In effect, it does what a carbose attempts to do but without gas, without diarrhea, and without a $300 monthly bill. Clinical research shows that 1 teaspoon of Ceylon cinnamon taken with a meal can reduce post-meal blood sugar spikes by 29%. Marvin stared at me in disbelief. "My endocrinologist never mentioned cinnamon," he said. Of course she didn't. If a spice costing pennies a day could stabilize blood sugar, there would be no need for expensive prescriptions, constant dose adjustments, or follow-up visits to manage side effects. There's no profit in telling patients to buy a spice. But here's the part most people never hear. Not all cinnamon is safe. The cinnamon sitting in most kitchens right now is almost always cassia cinnamon. Cassia contains high levels of coumarin, a compound known to damage the liver when consumed regularly. Daily cassia use, which is required for blood sugar control, slowly increases the risk of liver injury. The European Food Safety Authority has issued warnings against daily cassia consumption because of coumarin toxicity. Ceylon cinnamon is different. It contains almost no coumarin. It's safe for daily, long-term use, and it works. I told Marvin to throw away the cinnamon he had at home and replace it with true Ceylon cinnamon. 1 teaspoon with every meal. Breakfast, lunch, and dinner. No exceptions. He was skeptical. How can something this simple work better than medication? I explained the mechanism. Once he understood how insulin sensitivity works, he agreed to try it. Within 1 week, his blood sugar roller coaster flattened. Let me explain why. When you eat carbohydrates such as bread, rice, pasta, potatoes, fruits, your digestive system breaks them down into glucose. That glucose enters your bloodstream, raising blood sugar. In a healthy person, insulin is released. Cells absorb the glucose, and levels return to normal within 2 hours. But in insulin resistance, which affects most people over 60, cells don't respond properly to insulin. The pancreas compensates by producing more and more insulin. Blood sugar stays elevated longer, damaging blood vessels. Then comes the second problem. Eventually, the pancreas overshoots. Too much insulin floods the bloodstream, forcing glucose too low. That's reactive hypoglycemia, the shaking, sweating, dizziness, anxiety, and mental fog. Spike, crash, spike, crash all day long. A carbose attempts to reduce this by blocking carbohydrate breakdown. But undigested carbs ferment in the colon, producing gas and diarrhea. Cinnamon works differently. It enhances insulin sensitivity. The active compounds, particularly cinnamaldehyde, activate insulin receptors on your cells. Your cells respond better to insulin, so less insulin is needed. Blood sugar falls smoothly instead of crashing. Cinnamon also slightly slows gastric emptying, the rate at which food leaves the stomach. Carbohydrates enter the bloodstream more gradually, reducing spikes. This dual effect explains why cinnamon stabilizes blood sugar without digestive side effects. A landmark study published in Diabetes Care tested cinnamon in people with type 2 diabetes. Participants consuming 1 to 6 grams daily experienced fasting blood sugar reductions between 18 and 29%, along with improvements in cholesterol levels. Another study tested Ceylon cinnamon specifically with a high-carbohydrate meal. Post-meal blood sugar spikes were 29% lower compared to meals without cinnamon, with no side effects. But every one of these studies used Ceylon cinnamon, not cassia. Cassia cinnamon contains 1,000 times more coumarin than Ceylon cinnamon. Daily cassia use can exceed safe limits and cause elevated liver enzymes, inflammation, and long-term liver injury. Ceylon cinnamon does not carry this risk. When Marvin showed me his cinnamon bottle, the label simply read cinnamon. No origin, no species. That meant cassia. Almost all generic cinnamon sold in the U.S. is imported cassia. He discarded it immediately and ordered Ceylon cinnamon. I instructed him to take 1 teaspoon with each meal, mixed into oatmeal, coffee, soup, vegetables, or meat. Day 1. His breakfast spike dropped from 230 to 195. 2 hours later, no crash, glucose held steady around 95. Day 3. Post-meal peaks dropped to 165. 2 hours later, stable at 110. By day 7, his glucose monitor showed a completely different pattern. No spikes above 170. No crashes below 80. For the first time in months, Marvin felt normal. By the end of the first week, Marvin's continuous glucose monitor looked like it belonged to a different person. His post-meal spike stayed consistently below 170. The dangerous crashes, the drops into the 60s and low 70s were gone. His blood sugar stayed stable throughout the day. His fasting glucose also began to fall. It dropped from 120 to 105. Not perfect, yet normal is below 100 but clearly moving in the right direction. I want you to understand why this works, because once you understand the mechanism, it becomes impossible to dismiss. Cinnamon contains several bioactive compounds that directly affect glucose metabolism. The most important is cinnamaldehyde, the compound responsible for cinnamon's aroma and taste. Cinnamaldehyde activates insulin receptors on the surface of your cells, making them more responsive to insulin. When insulin sensitivity improves, your cells pull glucose out of the bloodstream more efficiently. Your pancreas no longer has to flood your system with insulin. Less insulin means no rebound crash. Cinnamon also slightly slows gastric emptying, the speed at which food leaves your stomach and enters the small intestine. When carbohydrates enter the bloodstream more gradually, blood sugar rises more slowly. The spike is blunted. A study published in the American Journal of Clinical Nutrition demonstrated this clearly. Participants consumed a carbohydrate-heavy meal with or without cinnamon. With cinnamon, gastric emptying slowed just enough to significantly reduce post-meal blood sugar. Glucose peaks dropped from 185 to 150, a nearly 20% reduction, simply by adding cinnamon. This dual effect, improved insulin sensitivity and slower glucose absorption, explains why cinnamon stabilizes blood sugar without digestive side effects. Contrast that with acarbose. Acarbose reduces post-meal glucose by roughly 25 to 40 milligrams per deciliter. Cinnamon reduces it by 20 to 50 milligrams depending on dose and study design. The effectiveness is essentially identical. The difference is tolerability. Between 30 and 50% of patients stop acarbose within the first year due to gastrointestinal side effects. Cinnamon causes none. And cost. Acarbose runs about $300 per month. Ceylon cinnamon costs roughly $12 per month. Now here's the safety detail that cannot be ignored. Most cinnamon sold commercially is cassia. Cassia contains high levels of coumarin, a compound known to cause liver toxicity when consumed daily. The European Food Safety Authority has warned that chronic cassia consumption can exceed safe coumarin limits and damage the liver. Cassia cinnamon contains 5 to 12 grams of coumarin per kilogram. Ceylon cinnamon contains about 0.004 grams per kilogram, more than 1,000 times less. Using 1 teaspoon of cassia cinnamon daily can exceed the recommended safe intake, especially in older adults. Long-term exposure is linked to elevated liver enzymes, hepatitis, and in severe cases, liver failure. Ceylon cinnamon does not carry this risk. It is safe for daily, long-term use. When Marvin switched exclusively to Ceylon cinnamon, he followed a strict protocol: 1 teaspoon with every meal, breakfast, lunch, dinner. He mixed it into oatmeal, coffee, soup, vegetables, and even savory dishes like roasted chicken. Ceylon cinnamon has a mild, slightly sweet flavor that works with both sweet and savory foods. Consistency mattered. Cinnamon only works when it's present with the meal. Skip the cinnamon and the spike returns. After 1 month, Marvin's endocrinologist reviewed his data again. His glucose curves were smooth. His hemoglobin A1C had dropped from 7.8% to 7.1%. His fasting glucose hovered around 102. He had lost 4 pounds without trying, likely because stable blood sugar reduced his cravings. She asked if he'd restarted acarbose. He told her the truth. Ceylon cinnamon, 1 teaspoon with every meal. She was skeptical, but the numbers spoke for themselves. By month 3, Marvin's A1C reached 6.9%, just above the non-diabetic threshold. His blood sugar was stable. His energy was back. The anxiety caused by crashes had disappeared. Sitting in my office, Marvin became emotional. "I spent months suffering on medication," he said, "and all I needed was cinnamon." Here's the exact protocol again. Use Ceylon cinnamon only, also labeled Cinnamomum verum. Avoid any product that simply says cinnamon. Take 1 teaspoon with every meal. Monitor blood sugar closely for the first 2 weeks. If you're on diabetes medication, speak with your doctor. Doses may need adjustment. Do not use cassia daily. Your liver depends on this distinction. Cinnamon supplements exist, but powdered cinnamon mixed with food is absorbed more effectively and costs less. If supplements are used, they must be Ceylon-derived, standardized for polyphenols. The result you should expect: within 1 week, post-meal spikes fall. Crashes stop. Energy returns. Blood sugar stabilizes. A kitchen spice did what a $300 prescription could not, without side effects, without damage, without dependence. And remember, always consult a qualified healthcare professional before making changes to your health, diet, or lifestyle. Subscribe to this channel and let us know from where you are watching. And share this video to your friends and family. Thank you.